from Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi everybody, welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today for the third and final part of this mini-series regarding both inpatient and outpatient rehabilitation. Today we're focusing specifically on cardiac rehab patients and their recovery. For this first part of the discussion today, we're joined by cardiologist Dr. Hakeem Morsley, the medical director for the cardiac rehab program at Sarasota Memorial. Dr. Morsley, thank you so much for joining us.
Thank you for having me.
What is cardiac rehab exactly?
So there are three phases to cardiac rehab, phase 1, 2, and 3. We focus mostly on phase 2. It's a multidisciplinary, outpatient, well-structured, medically supervised program servicing the needs of patients with heart disease. So broadly speaking, it consists of exercise sessions, didactic lectures, and support groups. So the goal of cardiac rehab is to increase quality of life, increase cardiovascular health. Ultimately, the goal is to decrease cardiac mortality and decrease hospital readmissions. So what we want to do in our program is to provide patients with the knowledge, structure, and the support system. In fact, if you look at the American Heart Association, multiple studies have been published which repeatedly show that patients who complete cardiac rehab have a significant decrease in cardiac-related mortality as well as all-cause related hospital readmissions. And this is a very important point considering the heavy economic burden heart disease carries in the United States. If you look at the data, we estimate approximately $20 billion annually go to hospital-related care of heart patients. Back in 2019, the Center for Disease Control did a pretty remarkable study in which they projected around $250 billion lost in 1 year solely due to heart disease when looking at medical care as well as loss of productivity in the economy. So it's no wonder that this is at the forefront of our medical community. One of the major challenges we have in cardiac rehab is although patients are eligible, only a third get referred to us. And some of the biggest challenges happen to be the lack of awareness of the program, lack of access, cost of the program, and lastly, but importantly, is the motivational barrier.
Who should be referred to cardiac rehab? Because you mentioned that so many who should be are not being referred.
That is correct. So we have 7 indications for cardiac rehab eligibility. First one being patients who've suffered a heart attack requiring a stent, so a tube opening up a blocked artery. Patients who have heart disease who electively underwent a stent to treat refractory angina, chest pain unrelieved by optimal medical therapy. Patients who have heart disease with ongoing daily stable angina, so that's chest pain with exertion despite being on optimal medical therapy. Patients who have heart failure with a low heart pump, we call that heart failure with a reduced ejection fraction. Those who have undergone heart surgery. And for those who have undergone surgery, it's a pretty encompassing indications. The first one being coronary artery bypass, valvular repair or replacement, or aneurysm repair. Patients who had a heart transplant, patients who have what we refer to as LVADs, left ventricular assist device systems. Those patients who usually have end-stage heart failure and require a circulatory pump to help them live. And then lastly is patients with peripheral arterial disease, so plaques in the legs usually, or the carotid arteries, the neck arteries. Those patients can suffer from pain upon ambulation, and that's known as claudication.
So if I'm understanding you correctly, cardiac rehab can be used before or after a procedure by an interventional cardiologist or a heart surgeon?
Well, after. So you have to have had the event, whether it's a heart attack, whether it's heart failure exacerbation, or whether it's a heart surgery.
So what are some of the unique challenges this patient population faces that your team hopes to address in cardiac rehab?
That's a very good question. So they're plentiful. The first one is physical limitation, weakness, pain. For example, patients who've undergone heart surgery, they need time to heal their wounds. Those who've been hospitalized with heart failure can be quite debilitated, having stayed in the hospital several days, some a few weeks. And those are some of the challenges we address right away. We gauge patients' energy level, strength level, and devise a protocol depending on how strong or how weak they are. Other factors are fear factor. A lot of patients are afraid to get back into the routine, thinking that exertion might trigger another event. Some patients are depressed. The feeling of no longer being invincible. I just had a heart attack. The vulnerability factor, social isolation. I'll give you an example. Patients with heart failure who are now short of breath, have ankle swelling, are afraid that they won't be able to go play bowling with their friends, hike with their family members. Feeling of overwhelmness, where patients all of a sudden go from no medications to 4 or 5 different medications to be taken throughout the day. And then last but not least is we refer to as the lifestyle overhaul resistance. So patients need to adapt healthier lifestyles, quit the bad habits, and adapt the healthy ones.
So can you talk a little bit about the multidisciplinary team at SMH involved in this cardiac rehab program?
Yes, we believe that the multidisciplinary angle to cardiac rehab is its core strength. And if you look at it, it's not a one person calls the shot. It's rather teamwork where everybody plays an indispensable role. You have the medical director, who is usually board certified cardiologist. He or she learns about the patient from a medical standpoint, reviews charts at initial evaluations, and understands and foresees any pitfalls or challenges that patient might have. During rehabilitation, the medical director has to be keenly aware of any changes in clinical status concerning symptoms, concerning vitals, and if intervention is required from a medical standpoint, usually the director does that in conjunction with the patient's primary cardiologist or surgeon. And this is a very important take-home message. We do not make any changes without the blessing or the approval of the patient's primary medical team. Then you have registered nurses, who are really the glue that keeps everything together. They check on patients' vitals in between exercise sessions, check glucose levels on diabetic patients. They even do a checking on the incision wounds, make sure everything it looks good. If there's an issue with dressing, oozing of the site, they let the medical director know right away. They can also do teaching. They can do drive-by teaching on how to properly check blood pressure at home, how to do acu checks properly, so on and so forth. We have exercise physiologists. Their main role is to devise and supervise the exercise portion of the rehabilitation. So patients usually go on our treadmills, stationary bikes, they go on rowing machines. Most of our patients are hooked up to telemetry, which is an EKG machine, and any form of arrhythmias are picked up right away by the exercise physiologist and communicated to the director right away. The nutritionists are also available to devise and teach our patients healthy eating habits, what is bad fats versus good fats, how to read food labels. And then last but not least is our behavioral therapists, which manage the mental fallout from heart disease. Data suggests that up to 25% of patients with heart disease will suffer some form of depression. So this is a very important task at hand.
Is it ever too late for cardiac rehab? Can a patient be too old to improve their heart function or too far out from surgery?
Those are two good questions. So technically, it's never too late for cardiac rehab. However, from a practical standpoint, we encourage patients referred right away as soon as they get discharged from the hospital. In fact, here at Sarasota Memorial Hospital, we have orders where patients are referred the day they are discharged. If you look at the data, patients who start rehab as soon as feasible, so long as they're feeling strong enough, those patients do better long term. The longer one waits to refer a patient, the less likely that patient will go through the program. With regards to whether patients are too old, no, but too frail, yes. So there are patients who are simply too frail at the beginning or should I say, they're too frail upon discharge and might take a few weeks to heal from the surgery, to continue to gain strength at home from their heart failure exacerbation. But once the patients are felt reasonable, then they can be referred. And then sometimes we have patients who are just simply too frail. And those patients, unfortunately, are not ideal candidates considering that exercise portion of rehabilitation is so important to us.
How long is the typical cardiac rehab program? Can you just talk a little bit about how it typically works?
Yep. So I mentioned that there are 3 phases to cardiac rehab. Phase 1 takes place in the hospital. Let's say a patient is admitted with a heart attack. The patient goes to the cath lab and requires a stent. The next day, the nurses are already evaluating the patient, their strength. Can the patient walk? How is their balance? In addition to nursing evaluation, physical therapists, occupational therapists come into the picture and again gauge the patient's strength, whether or not the patient will require inpatient rehab versus outpatient rehab. So that's the first phase. Upon discharge, the patients enter phase 2, and this is where we come in. Phase 2 usually takes about 3 months. It's 3 sessions per week, up to 90 minutes. The Dean Ornish program is a more specialized version of cardiac rehab. That program can last up to 2 hours per session. Although it's a 3-month program, there is flexibility to the program. So if patients, for example, are hurt themselves or have to go away for a week or 2 for an emergency, you can pause the program and then resume it. We've had patients who start the program down here, our snowbirds, have to go back up, and they can finish the program up north and vice versa. Phase 3 is the lifetime commitment phase. When patients graduate phase 2, we encourage them to continue to exercise. This program is not meant for short term. This program is meant to continue with healthy lifestyle, continue to exercise, continue with healthy eating habits. And that program is usually under less supervision. However, patients can report to us every so often, like they do here at Sarasota Memorial Hospital.
Is there anything else you want to add, specifically related to how patients should go about looking to get cardiac rehab if they're interested?
So, we encourage patients to talk to their doctors, ask their doctors if they're eligible. If they are eligible, they will require a physician referral. With a referral, give us a call and show up. If patients are not sure whether or not they are eligible or their physicians are not entirely clear, we welcome them to give us a call. We can certainly, go over, that over the phone. But patients will require a referral from a physician.
And it's so important that if they are eligible, we start seeing those numbers go up as far as taking advantage.
Absolutely. And as mentioned, the earlier patients start, the better off they do. Just in summary, again, to emphasize that cardiac rehab, we feel, is a very, very important aspect of patient care. Not only enabling patients to recover faster, but providing them with the knowledge and skill set to achieve lasting lifestyle changes, and thereby reducing future cardiac events. And so with the data I shared today, I hope to have convinced you that any eligible patient not referred to cardiac rehab is an opportunity missed.
Dr. Morsley, thank you so much for being with us. And for the next part of this discussion, we're joined by Meredith Cleveland, the supervisor of the cardiac rehab program here at Sarasota Memorial. Meredith, thank you for being with us.
Oh, you're very welcome. Thanks for having me.
Can you talk about the specially trained team involved with this cardiac rehab program?
So in our cardiac rehab program, we have exercise physiologists who work with our patients. Basically, all of our exercise physiologists either have a bachelor's degree or master's degree in exercise science, exercise physiology. Most of them have years of training background in cardiac rehab, a little bit more clinical experience. Actually, a lot of our employees have been interns with us, so we'd love to hire the interns, the students that we've trained.
What is unique about the cardiac rehab team here as compared to elsewhere?
Well, I think that one, we try and bring in a lot of our interns, so we know them ahead of time. All of our exercise physiologists are all certified by the American College of Sports Medicine or the AACVPR, which is the American Association of Cardiovascular and Pulmonary Rehab, which is the organization that certifies our program. So that is a requirement. So all of our staff are specifically, they have their degree, but then they're also specifically trained in cardiac and pulmonary rehab.
Dr. Morsley mentioned earlier that there's also it's a multidisciplinary team, and it involves everything from eating habits, lifestyle changes. Can you talk a little bit about the entire team?
Yeah, so we actually have two different cardiac rehab programs. We have our traditional cardiac rehab program, which has our exercise physiologist and really focuses on exercise and some risk factor modification. And then we also have our Dr. Dean Ornish intensive cardiac rehab program. That is more of our multidisciplinary lifestyle program. And with that program, we have a nurse case manager. We also have a certified exercise physiologist. We have a registered dietitian. And then we also have a stress management specialist as well.
You mentioned that Dean Ornish program. Can you talk a little bit more about what that is and who that's for?
Yeah, so the Dean Ornish program, which is our intensive cardiac rehab program, I always say it's traditional cardiac rehab on steroids, basically. So traditional cardiac rehab, they're coming in for 1 hour sessions with the clinical staff, really just focusing on exercise and their cardiovascular endurance. Whereas the Ornish program, these patients are coming in twice a week for 4 hours. The diagnoses that are covered by insurance are the same. So typically patients can choose which program they want to participate in. So we kind of leave that up to the patient to kind of make that choice for themselves. So the doctor will write an order for cardiac rehab, and then they can make that decision of which one they feel is, right for them at the time.
How do you help patients decide what's best for them and improving their health?
Yeah, our clinic coordinator, who actually is also our stress management specialist that works with the Ornish program. So she talks to them on the phone and she really just kind of feels them out a little bit. We have some patients who this is their first time ever having a cardiac event and they're really scared and they will do anything and everything to make that change. You have some people that just want to just feel better in the moment and, they make the choice to do traditional. You have some patients who have been through cardiac rehab a few times and they've finally decided that, now is really time to make that big change. So we kind of meet them where they're at. And so some patients, decide to do traditional and some decide to do intensive.
So if a patient is referred for cardiac rehab, what does the program look like for them? How do they get started? Is everyone, if they do traditional or Dean Ornish, is everyone who's on those tracks very similar or is it very patient specific?
Well, it is very patient specific. So every patient will come in for an evaluation with the clinical staff. They meet either with our cardiac nurse if they're doing intensive cardiac rehab or the clinical exercise physiologist if they're doing traditional. And really, we just go over their medical history with them. We set goals for them. So we talk to them about, is weight loss a goal? Is, being able to get back into a fitness center and work out 3 times a week their goal? We've had some patients coming in and they want to do a 5K. So, we really work with them of what their individual goals are and go from there.
What are some of the most common goals that you hear from patients, especially after such a scary cardiac event?
A lot of our patients, it's really just a matter of just feeling better. So decreasing fatigue is a huge one, especially those that have had open heart surgery. A lot of times they're just really tired. And of course, they had major open heart surgery, so they are going to feel a little bit, more fatigued than probably before. And so there's some of that. Weight loss is always, I think, a goal for some people. We do see a lot more weight loss in our intensive cardiac rehab patients just because it's a total multidisciplinary program. Then things just like, getting back into the gym or being able to play with their grandkids. Just really feeling better, I think, is the main goal for most of our patients.
So what tools, technology does your team have to help achieve these goals? How do you work with patients who come to HealthFit to meet with the cardiac rehab program?
Yeah, so for both programs, the patients are hooked up to a EKG. So we're able to look at their heart rate, their heart rhythm. So they're hooked up to the telemetry. We're measuring blood pressures on them before, during, and after exercise as well. They do have the full range of the fitness equipment. We're very lucky that we are located at HealthFit. So those patients will have treadmills, bicycles, recumbent stair steppers, a full array of weight training machines. So it's a great way for them to kind of transition into whether it's HealthFit or another fitness center. The intensive cardiac rehab patients also have access to a full online portal that has videos, recipes, different things like that for them as a resource.
I know Dr. Morsley mentioned earlier as well that it's really important for these patients to have access to other patients going through cardiac rehab.
Yeah.
Can you talk about the importance of community to these patients?
So that actually is a really big benefit to the program, and it's something that I think people don't really think of until they're actually in the program. So traditional cardiac rehab, I always say, is more like a revolving door. Patients are coming in and then they're graduating all at different times, which is kind of nice because patients will come in, it's their first day, and maybe they're on the treadmill next to someone who's been there for 3 months and they're just about to finish. So, sometimes they'll strike up conversations, and it's kind of nice for someone who maybe is fresh out of surgery to kind of get feedback and, see how someone who's now 3 or 4 months out of surgery, how they're doing. So that's a benefit that goes along with the traditional program. Whereas in intensive cardiac rehab, it's actually done in a cohort. So those patients, it's a small group, usually between 6 to 12 patients. They all start at the same time. They all finish at the same time. And they do have like a group support session while they're with us twice a week. So that's really nice too. And I think for us, for staff, it's really nice to see so many different patients, different ages, different walks of life, different even, they all have different cardiac, histories. Some have bypass, some have had a heart attack, some have had, heart failure. They're all complete strangers on day one. And then by like week 9, they're like all like buddies, and then their wives come in or their husbands, and it becomes this really nice supportive group. So it's kind of like its own little support group, I always tell patients.
And how important is that for their overall well-being, that mental health aspect?
Yeah, I think really important. And actually our intensive cardiac rehab program through Dr. Ornish is the only intensive cardiac rehab program that incorporates group support. But I think it's great. I think for a lot of patients, it's very scary after a cardiac event. We do see high numbers of depression, anxiety, isolation after a cardiac event. And so coming into something like a cardiac rehab, whether it's traditional or intensive, I just think is really great. It gives patients something to look forward to. They get to meet other people that are going and feeling the same things that they have. So I think it's a really kind of unique type of rehab for these patients to go to.
What do you think is most important for patients and their families to know? Maybe they're getting referred for cardiac rehab now, or they're thinking that they'd be a good candidate for cardiac rehab. What do you want them to know?
Again, it's a great place for patients to, if they were active prior to feel confident in getting back into a regular exercise routine, making those lifestyle changes, and especially because they're coming in a few times a week with our clinical staff, so we're monitoring their heart rate, their blood pressure. I think it just really gives them that confidence after a cardiac event.
Is there anything else you want to add?
It's a great program. Our intensive cardiac rehab program is the only intensive cardiac rehab program in the state of Florida that is at a hospital facility. We are actually only one of 12 programs across the entire country. So we're really lucky to be able to offer this program to the community and even the surrounding communities. We've had patients drive from Orlando, Miami, Tampa just to come here to Sarasota Memorial to do the intensive cardiac rehab program.
Meredith Cleveland, thank you so much for joining us,
welcome
and thanks for
so
answering
much.
all these
Thanks.
questions. We also want to thank Dr. Morsley, who kicked off today's discussion. As always, we encourage everyone in our community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.